Hello everyone, my name is Ashley Segobiano and I will be presenting our group's poster regarding assessing the relationship between food insecurity and race in University Health Emergency Department patients who have at least one chronic illness. Introduction. University Health at the center of Kansas City's urban core is Missouri's only safety net hospital. University Health Emergency Department consequently serves a diverse population with a wide variety of chronic illnesses. Characterizing University Health Emergency Department patients' social determinants of health may assist providers with delivering equitable preventative care. One of said social determinants of health of particular interest is food insecurity, and whether or not there is a relationship with race. Methods. The data presented in this poster is preliminary data from an ongoing study representing 308 unique patient entries. We estimate that we will achieve sufficient power with 385 entries. Ordinal age groups were based on U.S. Census categories. The other demographical information was collected based on previously demonstrated associations between measure and need from prior literature. The other race and ethnicity groupings follow the U.S. Census categorization but also aligned with Hollinger's ethno-racial pentagon. Social determinant health domains included housing and stability, social connections, education, work, income, insurance, food insecurity, utilities, transportation, incarceration, relationships and intimate partner violence, exercise, substance use, and measure of psychological strain. Some overlap existed between the PREPARE and AHC-HRSN. Redundancies were resolved by eliminating duplicates. Two separate one-tailed chi-squared analyses were performed, comparing differences between mental and financial strain assessed using two questions that directly addressed food insecurity. The severity of food insecurity was categorized into the condition, financial or mental strain, being present or absent. The results of the two comparison groups are shown to the right, displayed underneath the specific questions utilized in the survey. Surveys were facilitated via REDCap and asked by trained student researchers. Results. Within the past 12 months, you worried that your food would run out before you got money to buy more. In the Black population, this was often true 21.6% of the time, sometimes true 18.9% of the time, and never true 59.4% of the time. In the White population, this was often true 14.9% of the time, sometimes true 23% of the time, and never true 62% of the time. The differences between these two groups was with often true 6.72%, sometimes true 4.1%, and never true 2.6%. The question we asked in our chi-squared analysis was, is there a significant difference in severity of mental strain as related to food insecurity between Black and white populations studied in this survey? We found that Black respondents were more likely than white respondents to report any concern that food would run out before getting more money to purchase more food. The second question that we used. In the past 12 months, the food you bought just didn't last and you didn't have money to get more. In the Black population, this was often true 16.8% of the time, sometimes true 21.6% of the time, never true 61.66% of the time. In the white population, this was often true 17.2% of the time, sometimes true 17.2% of the time, and never true 65.5% of the time. The difference between these two populations was often true 0.4%, sometimes true 4.4%, and never true 3.9%. The question we used in our chi-squared analysis was, is there a significant difference in severity of financial strain as related to food insecurity between Black and white populations studied in the survey? We found that race and any financial strain were not found to be associated. Conclusions. Through two questions that directly measured food insecurity, we found that there was a significant difference between Black and white populations in regards to whether they experienced food insecurity in the last year and to what degree. These findings will provide further insight into where focus should be placed for creating positive change in the university health patient population in order to optimize patient care by addressing social determinants of health. Changes implemented as a result of our study and their outcomes could be a means of future investigations. Future directions. Implement resources in the University Health / Emergency Department / Hospital to address regarding food access, a food pantry, stress management, behavioral health services, and then financial counseling and insurance program for our patients. Thank you so much for listening and have a great day.